Hello, everybody. Welcome to our newsletter interview for the month of December. I am incredibly excited to get to spend a little bit of time today with Lorrie Odom, who is the chair of our Health, Wellness, and Safety Committee. And we're going to chat a little bit about that because that is this month's focus of our newsletter. So I want to start by just asking Lorrie to tell me a little bit about yourself and your background in PTA.
Well, thank you, Stacy, for inviting me. This is really a pleasure. I'm actually a retired pediatrician, and I had a fulfilling career specializing in pediatric oncology hematology. I was quite privileged to work at what is now called Children's Hospital Colorado for the majority of my career. I love working with young people and their families, and since retiring, I've been volunteering with many youth-serving organizations. And I have to say that it's been another great privilege to participate in Colorado and JEFCO PTAs. I've been co-chair of Colorado PTA Health, Wellness, and Safety Committee since it was formally established in 2014. And the purpose of our committee is to provide PTA units, parents, students, school staff, communities with resources to promote the mental and physical well-being and safety of all students, and to advocate for healthy, safe, and nurturing school environments. So that's a little bit of what I'm doing now in PTA.
Thank you. We are so fortunate to have you. I don't know how we got so lucky, but you've just been an amazing wealth of information. And I think as that committee has sort of evolved over time, it's just been really rewarding to see all of the things we've been able to be involved in. And your knowledge and expertise is absolutely lent to that. So thank you for all the work that you've done with the committee thus far. My next question for you is just, what do you feel are maybe the three most pressing issues within that forum of health, wellness, and safety that we're facing right now?
Well, that's a good question. As you know, that there really are many challenging health, wellness, and safety related issues now. But I guess if I were to pick the three most pressing issues, I'd have to say that mental health, vaccinations, and probably nutrition insecurity. I can discuss a little bit about each one of these if that would be helpful.
Yeah, I think that'd be great.
Well, since the onset of the pandemic, there's been an upsurge of youth reporting mental health challenges. There was a survey by the Colorado Health Institute recently done in 11 to 18-year-olds that showed poor mental health reported by 8.8% in 2017, but rose to 18.5% in 2021. And other current surveys show that 30 to 40% of young people say they feel anxious, stressed, lonely, and/or depressed. And non-white teens report more challenges than their white peers. And there's also correlation with the child's state of mental health prior to the pandemic, as well as economic hardships experienced during the pandemic. Unfortunately, as I'm sure you're aware, the tobacco and marijuana industries have only made the problem worse by targeting youth with marketing of their products, especially targeting marginalized communities. And studies show that these drugs, the nicotine, marijuana, et cetera, only exacerbate youth mental health problems. They may initially seem like they help a little, but over time, it makes the problems much worse. And vaping is still considered an epidemic among youth, most of whom are currently using a disposable device called the Puff Bar, which now contains so-called synthetic nicotine made by the company or tobacco industry related organization to escape FDA regulations. and it still attracts youth by offering many appealing flavors. So that's another major issue in the mental health realm that is being encountered. But an extremely concerning aspect of this mental health crisis is that suicide is the leading cause of death for 10 to 18-year-olds in Colorado. As you know, I'm sure, Children's Hospital of Colorado declared a state of emergency for children's mental health in May of this year, noting that the need for youth mental health services far exceeded provider and inpatient bed capacity. Earlier this month, the governor actually announced nearly $12 million from the emergency discretionary federal pandemic funding to be allocated to create 45 additional youth treatment beds. And in April of this year, Governor Polis had signed a bill establishing a new behavioral health administration in Colorado to hopefully transform the delivery of behavioral health services and consolidate different programs and funding streams. Very recently, a group of influential state health leaders collectively asked Colorado lawmakers to use $150 million of the remaining $450 million of the American Rescue Plan Act, or ARPA funding, for youth mental health prevention, treatment, and recovery. Hopefully, this request will be approved by the state legislature in January of 2022 and help ameliorate the youth mental health crisis in Colorado. And then another issue, the vaccinations I was thinking of. We have great concern that routine childhood immunizations have dropped significantly since the onset of the pandemic and may result in reemergence of vaccine-preventable diseases if this trend isn't reversed. I know that it's been a big concern of Jamie Culp, our Colorado PTA VP of Field Service. Routine immunizations protect children against 16 infectious diseases such as measles, diphtheria, chickenpox, whooping cough, all of which can occasionally cause life-threatening complications. And the transmission to the broader community is also prevented by vaccination. Despite a rebound in routine immunizations, the rates are still lower than they were in 2019. And there are significant disparities between racial and economic groups, particularly among children of color. The recent rollout of COVID vaccines for 5 to 11-year-olds presents an opportunity to catch up on routine immunizations because the children can receive these vaccines at the same time as the COVID vaccine. Primary care practices where many children are likely to get the COVID shots usually have other childhood vaccines on hand. I should also mention that vaccines are regarded as one of mankind's 10 most important inventions and one of the greatest contributions to global health of any human invention. And childhood vaccinations was one of the founding principles of National PTA over 120 years ago.
Indeed.
Very interesting and important. And the third issue that I think is very important, nutrition insecurity. According to a recent poll by Hunger Free Colorado, 1 in 3 children are going hungry, and more than 37% of Coloradans are struggling to afford food, up 9% from a year ago, with families and people of color hit the hardest. Almost a quarter of parents reported that they had cut back on their children's meals. During the pandemic, emergency allotments have increased the Supplemental Nutrition Assistance Program, or SNAP, benefits for some families, but these could soon expire. SNAP has proven to be one of the most effective mechanisms available to reach low-income households, providing them with funds to purchase food at local grocery stores, helping families get needed nutrition while also providing a boost to the local economy. Fortunately, with nutrition waivers extended by the administration, school districts will actually be able to provide free meals for all students through the end of the 2021-22 school year. We'd like to see continued improvements in the nutritional quality of food served in schools. Because reauthorization of the federal child nutrition program again recently failed, however, advocating at the grassroots level, which is what PTA does very effectively, will definitely be needed to further improve the nutritional quality of school food.
Thank you. There's so much work that we've done, but it sounds like so much work still to be done.
You're so right, Stacy. That is absolutely true. We won't be bored.
No, indeed. And that all sort of leads me into kind of my third question. With all of this work to be done and lots of topics that people might be interested in or want to, be able to make a contribution to. Sometimes I will hear people say that they're too involved to get involved in a committee, that they're too busy to get involved in a committee, or that they just don't have the time to attend committee meetings. So how else do you feel people can stay involved in this type of work if they're interested in health, wellness, and safety topics?
Well, that's such a pertinent question, Stacy. At this time, with the ongoing stress of the pandemic and its ramifications, it's been incredibly difficult for everyone, but I think especially parents, teachers, and students, hard for them to find time in their days to participate in committees. And in addition to the day-to-day disruption, I think the ongoing uncertainty, not knowing what's around the corner and when we can get back to a new normal is also stressful for everyone. So although we wholeheartedly welcome any PTA member to participate in our virtual Health, Wellness, and Safety Committee meetings, I think there are other ways that members can be involved in health, wellness, and safety. Starting early next year, some of our committee members will begin reaching out virtually to PTA units, especially in under-resourced areas of Colorado. We want to learn about health, wellness, and safety issues that are specific to that unit, the school, the parents, and students, and how our committee can actually be most helpful to them. And we also want to establish how to best facilitate ongoing communication with the PTA units. This will hopefully prove to be a convenient way for busy parents to be involved with this health, wellness, and safety work. And PTA members can also participate in related advocacy action items that are posted on Colorado PTA's social media and website. These pertain to issues like school food, promoting recess and physical activity at school, immunization advocacy, approaches to decrease availability to youth substances such as nicotine, marijuana, and vaping products, etc. The PTA unit president is usually also alerted to these action items and disseminates the information to the unit members. So that's another way to be involved. Additionally, I think working with the wellness team at the school, if there is one, not all schools have one, but that can be a great way to have meaningful impact in this area. And we know that for students with mental health issues, having an adult emotional support available can actually be life-saving. Giving one additional young person such support, asking open-ended questions, or just listening to that young person as a trusted adult can have an extremely positive impact on the mental health of that individual. So thank you for all your insightful questions, Stacy. I really appreciate them.
Yeah, thank you for taking time to chat with me. I think again, lots of work to be done, lots of great opportunities and different topics that I know we'll have members that are interested in. And I think we're always interested in feedback. If people have ideas about, other areas they'd like to see us involved in, or endeavors they would like to see us, take on. There's really nothing too small or too large. I think at this point we've done a little bit of everything, and I love what your committee is doing. I love the idea of really reaching out to the local units and trying to work a little bit more closely and make sure we're representing all children. So thank you for all the work that you've done and that you continue to do, and just for being a part of our PTA family. I sure appreciate it.
Well, I appreciate this. It's an honor and a privilege. So thank you very much.